How are you today?
Pretty good.
So, thank you for coming today. And this is like the last visit after we had the fecal bacteriotherapy done for you.
That's good.
So, tell me, your story was because of your problems with your lungs that started, and then we ended up having to treat you for C. diff because of your diarrhea that happened in May after a dog bite when you got antibiotics.
That's right.
So, tell me, what were your fears regarding C. difficile?
Well, the thought of the stool and getting in your stomach and really sounded awful.
Okay.
And I hated to even tell people, what I was going to have done.
Okay. So, but then what, you're having a lot of cramping and diarrhea, and finally you agreed to do the fecal bacteriotherapy.
Right, yes. I didn't want to keep on going.
So, were you fearing that you were going to die?
I never felt like I was going to die, but if it kept on, I probably would have.
Okay.
But
how was the whole process? What did you think you were? Did we explain the thing, and did we give you all the options and tell you different things?
Oh yeah, and I read a lot too about.
What did you get to see the YouTube video that we have? And
oh yeah, I watched your YouTube. That was nice.
Yeah. So so how did you think about your I think you are more than I have done more than 100 or so people with this way of doing it. So can you explain in quickly what happened to you, and how was the process?
Everything went really well, and I was pretty apprehensive, and the procedure wasn't near as bad as what I thought it was going to be.
So how do you explain from your standpoint about the procedure?
The procedure was very simple, and the worst part was putting the tube down.
Oh, that was the worst part of the tube. Okay.
Yes. The first putting the tube down to the
through the nose, through the small bowel,
yeah. That wasn't that bad, but it was quick. It didn't take that long.
And Jim was your poop fixer.
Yeah, he was.
He literally gave you shit, huh?
Yeah. I call it poo.
Okay. Let's call it poo. So, Jim, do you have anything to tell about this whole process?
No, the only thing is during the process that it wasn't hard to do really if you just take your time and do it slowly and the process it sounds a lot worse than what it really is to do. So.
And then her diarrhea stopped within 48 to 72 hours after we did the procedure, if I remember well.
Yeah, I had, I think,
and
just
then,
2 days where I still had some diarrhea.
And this was like a 3-month follow-up after that.
Right, that's right.
Yeah. So do you have any final thoughts on people who might doubt this process or who might be worried about this process of fecal bacteriotherapy?
Well, I mean, I can see people worrying about it, but it really was so much more simpler than what I thought. I thought it would be a lot worse.
And how about the pre-procedure stool testing and all that we did? Luckily for you, I think your insurance company covered it.
It covered mostly everything. All we had to pay was a few deductibles.
And you're one of those lucky guys. And thank you for bringing all the bills that you have. Hopefully, I'll get to review them. But thank you for agreeing for this interview. And hopefully, people will be seeing this. And hopefully, down the road, now we are using it for chronic treatment after 3 episodes like you had. But hopefully, down the road, the FDA hopefully will approve it for acute patients too, so that these processes and these problems don't have to happen.
That sounds great.
Yeah.
Thank you very much.
Thank you very much. We appreciate all that you've done.
It was my pleasure, dear. Thank you.